You have a very interesting CV. You're an oral maxillofacial surgeon. You also are running very successfully a series of practices in Hong Kong, but also in China. What were some defining moments that actually made you to the person that you are today?
So I remember more than 30 years ago, I actually attended a course. It was my first encounter of dental implants. And instantly, at that moment, I knew it was a game changer for dentistry.
So welcome to Straumann ProTalk. Welcome to the Pulse of Dentistry. My name is George Reber, and together with my co-host Andreas Utz, we are very pleased to welcome for this episode Professor Dr. James Chow. So welcome Andreas, welcome James. It's a great pleasure to have you here. I know it's very busy times, and we appreciate that you are joining us here in the headquarters. Now, you have a very interesting CV. You're an oral maxillofacial surgeon. You also are running very successfully a series of practices in Hong Kong, but also in China. And at the same time, you're an entrepreneur. You are running your own business when it comes to 3D printing. And then on top of this, you are a technology enthusiast. So I'm very sure that today we are covering a lot of interesting topics for our listeners. We will first look at your personal development and have a conversation around that. And then also look into the specificities of the Chinese market a little bit, because it's happening a lot there, and you can share some insights. Then we will also look into how you run your business, how you became successful. And last but not least, it's going to be very interesting also to look at technological advancements, particularly in digital dentistry. So James, thanks again for being here. And maybe on a more personal note, could you introduce yourself in just 1 minute?
I think George already made a very comprehensive introduction, so I just make it short. So, as you mentioned, I'm a specialist in oral maxillofacial surgery, and I'm the managing director of our specialist group practice in Hong Kong. And outside the clinic, I'm passionate in teaching, education, and providing opportunity to shape the next generation of dentists in Hong Kong, in mainland China, and in the region, whenever I have this opportunity. And although I'm very committed in this area, but none of my 3 grown-up children have ever picked up a scalpel or a dental drill. And other than working and teaching, you may see me rendering a museum, soaking in a concert, or visiting a bookstore. And also, I like meeting up with new people for a great conversation. I think all this will enlighten me by providing me with a new insight. So this is about us, about me.
That's a very open personality, interested in new things, I can imagine. Now, when we look at those journeys of successful professionals like you are, then there are often some very defining moments that actually, in hindsight, if you would have known, probably you would have been almost scared to take that important decision. How was it for you? What were some defining moments that actually made you to the person that you are today?
Okay, if we are talking about my practice or my career, so I remember more than 30 years ago, I actually attended a course. It was my first encounter of dental implants. And instantly, at that moment, I knew it was a game changer for dentistry. Mm-hmm. But of course, at that moment, I didn't realize it would become my destiny. Okay, but definitely at that moment already, I think the idea of going into the dental implant career planted the seed at that time. Yeah.
And that defined then also how you took your first steps on education, but then also what made you actually choose to go in private practice? Because you're also very a gifted educator. As you mentioned before, you're interested also to share your knowledge with more and more people. Did you also consider staying at university? Was that an option?
After I graduated from the dental school, I was actually in private practice for a short period of time. But very quickly, I realized I did not like working alone in a tiny room. And then I decided I have to do something for myself, for my future. So I went back to school for my postgraduate training. And when I was a trainee, actually, I thought my future would be rooted in academia. So actually, I'm interested in, doing teaching, research in the university. But as time passes, somehow I decided to go out to venture into private practice. Of course, there are some background situation, because when in your introduction, you know that I also went to medical school. So at that time, being a maxillofacial surgeon, it is not mandatory. But my supervisor, he believed, a medical background would be very helpful in non-maxillofacial surgery. But when I finished my medicine, actually at that time, at that moment, there's no position available in the university. So of course I cannot, keep waiting. So I decided I opened my own practice, but I told myself, if I was doing something for my own, I want to keep the same standard as when I was a trainee in the university. I want to do the best for my patient. So this is somehow I start my private practice.
How does your medical training influence how you do dental surgery today? Does it still resonate and influence how you do medicine today?
When we talk about dental implants, okay, of course, whether we are talking about medical profession or dental professions, we are looking after patients. Okay, so the medical knowledge certainly help a lot, because our perspective is broadened, because we have more training on patient management compared to just receiving the undergraduate in dentistry. So it helped in the total patient management. But whether we're talking about dentist or medical physician or surgeon, the dental implant at that time was never taught in school. So we learned all this actually when we came out to work in the private practice. But I went to different places to learn dental implants at that time. Yeah.
When you decided to do the medical degree, this was not necessary. You took the extra mile when you decided to do this. How much is this typical for you and for your success, continuously going the extra mile?
You are right, Andrew, because as I said, it is not mandatory to have the double degree. But my original intention is to pursue some academic career. So I think it was something necessary. And coming out in the private practice, it adds value to my practice, but it is not something essential for performing dental implant procedure. Even though nowadays I also conduct a lot of complex procedures, but I continue to learn because I think learning is never ending. So there's always new technique, there's always new method, new equipment, new finding, new knowledge. So I'm full of curiosity. So I always want to learn something I don't really I don't fully comprehend. So I will dive deeper. I will spend more time to learn new things to make sure that I do better in my practice. Yeah.
I fully see this in dental because when we follow your career track and also we see what you have been doing, it really is a learning journey and you're very curious. Now, maybe more on a personal side, how does this curiosity translate in your personal life? Maybe also your technology interest. James Chow at home, maybe I imagine a lot of gadgets and a lot of technological stuff. How does it translate in your personal life, this curiosity?
When I look back, because nowadays I am very dedicated in all this digital workflow. And when I look back, actually, I start, taking up all this digital technology quite early. But I agree with you. It is the first time I think that I want something digital is out of my curiosity. I remember the first times I encounter the digital technology actually is 3D printing. And I actually come across an article in a journal, a magazine called Popular Science. And there's an article on 3D printing, talking about how to make use of 3D printing on the medical field. And then immediately I searched whether there's a company in Hong Kong selling 3D printer. And then somehow I was able to locate that company. And then I think I was the first
customer,
first clinic. Asking for the company to sell the machine to us. So this is the first time I really bought the 3D equipment to the 3D printer to the practice, and then I realized as long as we don't give up research, we try to find something that we want. Actually, it works out. So
constantly pushing the boundaries.
I think we come back to this technology topic later, focused on implant dentistry.
Yeah.
Let's speak a little bit about your practices. So soon you will run 5 significant practices in China and in Hong Kong, China meaning Shanghai. So tell us a little bit more, what is the focus of these practices and what is your secret to success?
As you know, I'm in a group practice. So I think the most important thing is, as I say, I don't like working alone. So I like the team approach. I like working with other colleagues. So that's why we have this group practice. But when you are in a group practice, and the most important thing is to keep everyone together. And I believe together we can all go farther away in our career. So you have to look after the egos of everyone, and you have to look after their expectations. So being a leader, sometimes you have to think of other people more often than yourself. So this is, I think, a very important point when we are running a group practice. And the other thing we always emphasize is if we want to do something, we want to do it the best way. So we always take the latest technology. We want to create a platform. It is not because we don't have this technique or technology so that we are not able to deliver our promise to the patient. So group practice with good partners, and then keeping everyone staying together to pursue the best for our patient. So by taking advantage of all this latest technology, I think is very important.
Just recently in China, there was a big change with the value-based pricing policy that was introduced by the government. I think a lot of listeners probably heard about this VBP or value-based pricing in China already. Can you explain a little bit more about it?
Yeah. The VBP is a central government policy. To make it simple, the purpose is to make dental implant treatment more affordable in mainland China. And I think the intention is good, but of course, it is somehow, we look at it as a more or less a disruptive idea, but we see the good side of it because in China, since the implementation of this VBP, the number of patients asking for dental implant treatment surged. Mm-hmm. And in fact, for most of the stakeholders of all this implant company in China, they actually see the volume of sales rise significantly. So, these are the positive signs. And of course, there are other concerns too, because suddenly, the volume increased. And however, the number of dentists capable of doing implants are more or less the same. So the demand of training is actually also rising significantly. But many colleagues now, they are very engaged with their busy schedule because there are so many patients. So, we see this kind of things happening. Yeah. But the purpose is to make dental implant treatment more affordable. And I think this is certainly a good thing for the general public if they really have the need to have their teeth replaced.
Did you have to adapt your business model after this policy was introduced? Was it different patients that came in, or more patients, or different indications you saw?
This central government policy actually targeted all these public institutions and the government hospital. So it is not a policy mandatory in private practice. But of course, the China market is quite unique because we see the public and the private, they are running in parallel. So there's something happening in the public side. They also have the effect spill
influence on the private.
Over to the private. So as I said, we see more patients, but the outcome is you may see more patients, but it doesn't mean you may earn more. But as a clinician, I have to say, patients have a choice. We have a choice. If you feel comfortable and you think it is good for your patients, I don't see it as a problem. Of course, sometimes local colleagues ask this kind of questions for our opinion. I think in every market, pricing is one thing, but there are also other considerations. We cannot say that, pricing is the only parameter affecting the way we practice.
Yes. To build a bit the bridge then to the technology topic, in your practice, how important is technology when you educate and convince your patients?
I have been working for more than 30 years, and we are running a referral-based practice. So most of our patients actually come because of word by mouth, because in Hong Kong we never market ourselves. So I have to say we are lucky because usually we see very good patients, very well educated, and also their expectations is most of the times is very reasonable, and they appreciate what we can offer them, And when we talk about digital workflow, it is heavily relying on technology. And of course, now we have all the diagnostic. So we have Cone CT, oral scanning, and also other gadgets for face scan, jaw checking, and then we have different types of computer-assisted implant surgery available. And all this help us to keep our promise to our patient because we plan the case digitally, and then we can actually execute the plan as we aiming at. And usually patient is very happy, especially nowadays because of all this development, we are able to deliver immediate function or immediacy to our patients. And this is very dramatic to our patient because they come with low teeth and then they left with their teeth, or they come for extraction, but when they go home already they have implant and they have the restoration. I think patients are basically very happy.
Yeah, that's life-changing, I think, for many of the patients that you're treating. And I saw some of your cases. They're really complex cases that also changed the quality of life for patients significantly.
Yeah.
And I think that's the perfect segue also to talk about, one of your, I would say, topics that are close to your heart, and we don't want to miss when you're here also the opportunity. So it's computer-assisted implant surgery, and more specifically also dynamic navigation and robotic-assisted surgery. So maybe for those that are less familiar with those technologies, can you explain a bit what is dynamic navigation and what is robotic-assisted surgery?
Okay. Actually, under the umbrella of guided surgery, we have the static. I think most of us are familiar with it. We're basically talking about surgical guide generated by 3D printing. And other than that, today we have this dynamic and also the robotic. So whether static, dynamic, robotic, we are talking about guided surgery. The purpose of guided surgery, of course, is we have the implant planted digitally, but we need to find a way to execute the plan. And all this technology are effective to allow us to transfer the plan from the computer to the oral cavity of our patient. But when we talk about dynamic, the navigation and also the robotic, it is a totally different mechanism from static. So we can look at dynamic as we are doing freehand surgery, but it is augmented by computer vision. And the computer visions allow us to see through our patient's jaw anatomy. And at the same time, the digital planning will become a map, which can be shown through this computer vision while we are performing the procedure. And then we will see the planned route of the implant position, and then the computer visions actually guide us to go along the predetermined route. So this is navigation. So, but what about robotic? So very similar to navigation, especially most of the robotic system nowadays is also an extension from navigation. So we are based, this system are based on the optical tracking using the camera system of the navigation. But there's a fundamental difference between robotic and navigation. And navigation is you have the GPS, but you are the driver. You know the route, but you drive to your destination. And robotic,
self-driving.
You have you have the robotic arm, and the robotic arm actually will assist you, or some robotic system is able to actually perform the procedure automatically. So, as you say, it is more like a full self-driving
car, so that we're still waiting for. So obviously in dentistry, it always starts to be a reality. Now, besides the technological fascination that it is possible, what clinical problems does it solve to do dynamic navigation instead of freehand or also static guides?
I think guided surgery, we are always looking for the accuracy. And from the literature or from the data available up to now, we see actually navigation, robotic, definitely they achieve very high level of accuracy. And if we compare robotic to navigation, we see robotic can achieve even higher in terms of accuracy. That means we see very minimal deviations of the actual implant position from the planned implant position. And what is the significance of it? Sometimes I explain to my patient, okay, so when we place an implant, the ultimate goal is to restore the tooth or restore their teeth. Okay, so the positioning of the implant is critical. The more accurate the implant is, and then we expect to see better outcome in terms of function and aesthetic. And how much accuracy is essential. At the moment, we don't have this line drawing. We don't have this data to allow us to draw a line saying that we cannot pass this limit. So I think the approach is the more accurate should be the better. And yeah.
What I hear very often, James, is that accuracy is one thing, but a lot of skilled surgeons would say, look, I'm very skilled to do this freehand and much faster. What would you respond to these?
I can tell from my own experience, okay? So as a human, okay, we improve our technique by learning, by experience, okay? But we also have physical limitation. For example, I have been working for 30 years. So can I continue to work for another 30 years? So this is one question. Because human, we get fatigue, we get aging. But robot, I mean, you don't have to think about this. And the other thing is, as a human, we try to be good every time. But I mean, there is always some outlier. That means I perform very well 9 days out of 10 days. But the last day, I just didn't achieve the same level of precision as my previous day or as my usual performance. It can happen with human. But robot will eliminate all this human error. And also the other thing is, okay, for machine, okay, by iteration, they can only become better and better. And I told you earlier, I like to helping the next generation of dentists to help them to develop their career, to provide education to them. No matter how experienced I am, no matter how much cases I can show to them, I mean, they have to learn from ground zero because they cannot inherit the experience or the skill directly from us. But with machine, again, I mean, the robot able to do this in Hong Kong in the future very easily through all this artificial intelligence. I mean, another robot of the same model in Basel, they are capable of doing the same thing.
Could do the same, yeah. It's and at one point in time, it's this question of superhuman performance with generative AI. I think because these systems can be trained by the best of a trade, there is this possibility to actually become much more superior. Now, we'll talk about it a little bit later. What it actually means in terms of patient acceptance. But before that, I wanted to ask you. You're applying dynamic navigation and robotics now in your clinic.
Right.
At which state is this technology? When you're talking about this, is it more in the future it will be possible to use it like this, or is it already usable today for daily clinical practice?
It is already here. It is already in daily use. So whether it's navigation, whether it's robotic, whether we are talking about treating patients in Hong Kong, in mainland China, or in the United States, we see robotic and navigations. They are working very well. Yeah, but of course, I mean, if we are talking about robotic, it is very new to the profession. We are not saying it is something already widespread, but it is here already.
So how many of your patients in your practice do you operate with the robot, and how many do you do in a different way?
I have to say most of the time I use navigation. So maybe 10% of my patients I use robotic because, as I said, patients have a choice, okay? So whenever we introduce new technique, we will provide very thorough explanation and also the sufficient information to the patient to consider. And the other thing is also when we are talking about this advanced technology, it adds some cost to the patient. And at least at the moment, I won't tell my patients navigation is inferior to robotic. They are comparable, so the patient can have a choice. And yes, but I will see when robot become more well-known to the profession and also to the patients, we will see more and more patients. They will consider this kind of technology. Yeah.
When we discuss robotics with dental professionals, then you can get very different feedbacks and opinions. So there is technology enthusiasts like you are that is like, okay, let's try this and let's use it in clinics. And then there is a lot of people that have outright refusion of actually just trying to do it. In other surgical medical fields, it's already quite standard. So in ophthalmology, for example, in neurosurgery, it has become a standard of care to also use robotics in many of those interventions. Is dental somehow lagging behind? How do you see this? How do you see the future? And why is it that there is still quite a debate whether it will have a positive impact in the future?
I look at this question from this angle. For example, if we talk about ophthalmology, I think dentistry and ophthalmology, we are talking about high precision. We are the same because when we place implant or when we restore the teeth, we are talking about micron level of accuracy. And so if we have a way to actually achieve the high level of precision, I think definitely it is something we have to go for. But in reality, in dentistry, because the surgical part and the restorative part, it is separate. And sometimes, I mean, certain level of deviation from the planned position can be compensated by the restorative work, which I don't think is same as in ophthalmology. So if they are doing a reflective surgery,
there is no corrective measure
right.
to actually.
Yeah, so that's why I mean in dentistry maybe there's still room for us to to play to see whether it is the time we have to all change to technology like navigation and robotic. It will take a while for this kind of technology to become democratized.
Mm-hmm.
Yeah.
As George already said before, James, you're doing a lot of complex reconstructions, full arch reconstructions, FP1 reconstructions. Beyond robotics, what was the major technology that changed your total workflow in your practice over the last, let's say, 3 to 4 years?
Yeah. I mean, for a long time, we are always looking for technology that can be integrated seamlessly so that we can achieve what we call the full digital workflow. And we spent more than 20 years working on this area. And just recently, we are very comfortably to tell our patients we can deliver our promise. That means if we promise the patients, we can provide them with the full digital workflow, we are able to do so. It's not because I'm getting better than before. It's because the technology development is now up to this level. And as Andrew mentioned, I mean, surgical tools is one important component, but we need good diagnostics, and then we need a very good restorative technique, so that after the surgery, we can really deliver the immediacy within a short period of time with the same level of accuracy as the navigation of robotic surgery. And nowadays, because of the advancement is in digital impression, including the intraoral scanning, including the photogrammetry, and also with the advancement in 3D printing and also the printing material, now we are able to, deliver the immediate restorations within hours, within the same day of the procedure, even when we are talking about the complex cases. If we are dealing with more straightforward cases, for example, a missing molar in a Hilda site, we can actually prefabricate the prosthesis, and then by taking advantage of the guided surgery, whether we are talking about surgical guide, navigation, robotic, all can achieve a high level of precision, then we are able to connect the prefabricated restoration immediately after the implants is being placed. So we feel very comfortable nowadays because we have the confidence. We know, this is what we can achieve, what we can provide to our patient. Mm-hmm. Yeah.
So maybe as a last question of related to that technology, where would you see it go 5 to 10 years? You're already very advanced. In 5 years, in 10 years, is your prediction that every larger practice will have dynamic navigation and robotics, or maybe is there something that you can imagine beyond?
Yeah. So if we are looking at the development of the technology, you can see the technology advancing very rapidly. In some area, we can say it is exponentially advancing. So we expect to see things keep changing or evolving in a short period of time. But of course, to democratize all these technologies, there are other questions we have to address. For example, the cost. I think this is one thing, whether it is from a company perspective or from a clinician perspective, this is something that we also take into consideration. But personally, I always look at the efficiency of the workflow and how effective is the technique. Then the last thing I consider is the price. But it is, of course, something we still have to consider. I think if I tell you I don't consider the cost of setting up all this, I think it is irresponsible because, in real world, this is something we have to take into consideration. So whether all this technology will democratize at the same pace as the technology being advanced, I think there's other factor. We have to work together from the company or from the professions. We have to work together to see how can make it more acceptable to the patient and at the same time to the clinician. Yeah.
James, you shared a lot of incredible insights with us. Thanks a lot on the technology. What is the question you brought and you would have to us?
Since we are talking about all this technological advancement, so I'm also curious. And Straumann, as the industrial leader in implant dentistry, I'm interested to know what is the value or what is the significance for the company to actually develop your own navigation system, or maybe in the future, a robotic system. What is the significance of this?
Maybe I can start and then Andreas, please jump in.
Please, yes.
So, I mean, we started this journey already quite some time ago, and you might have seen also with the Falcon, we have a first product on the market that actually, tries to make dynamic navigation something which is less cumbersome and also accessible for clinicians for all kinds of different cases. So for single cases, but also for larger cases with multiple implants. And we did this because we were strongly believing that there is a benefit of dynamic navigation over static navigation. And we see that the setup time, also the independence of waiting for a guide when you plan it. The goal is actually with dynamic navigation that you can do it on the spot. So you can plan your case and then you actually move directly to surgery. And on top of this, I believe it's also giving the surgeon much more flexibility to react to the individual patient situation on the spot. In a guide, you're still quite confined, so you don't have the haptic feedback that you have freehand. So at the same time, it gives you also the confidence that you're exactly at the right position in the patient. So you talked before about the GPS, the intraoral GPS. We were very convinced that this is an important next step, and hence also our openness to take the next step and move further into asking the question, what clinical problems could robotics solve in the future, and also triangulate this with what are, let's say, the benefits for the patient, what are the benefits for the clinician, and what is a affordable, let's say, cost proposal to make this something that doesn't only work for very large clinics. That's on our mind very, very strongly. And to achieve this, I mean, there is different ways to go. So it could be open innovation in a sense that we collaborate with companies that are already quite advanced. It could also be own development. It could be with the help of OEM manufacturers, because we discussed before, there is a lot already that happened in the general medical field. So there are robots that are maybe too costly for orthopedics. There are robots that are too costly for neurosurgery. But if we can downscale this, there is a possibility to use this technology also for dental at an effective level. And hence, this is where we're currently at. So understanding what the potential is, what problem it solves, not being in love with technology, but actually taking it from the patient and the clinician's perspective, and then try to make or use technology to solve those kind of problems. And we see a lot of potential for this. So it's a very interesting journey that we're currently at, and we learn every day what it could be. And I have to say, also looking at markets like China, there is a lot more and faster advancements than we see today in Europe and also the US. So looking at those markets in China that are have a higher affinity, I think, also for looking at technology with an open mindset, can be very instructive for us to draw a way forward.
That was a very comprehensive answer. There's not much to add, to be honest. I think it's beyond this, as usual. It's laying the scientific evidence, for it, positioning it the right way. Making sure the right patients are benefiting from it. We put it into the hands of the right clinicians, and I think also together with the ITI to put the education behind. So we really want to give this technology into the right hands, and we feel, as George alluded, we feel the responsibility that also in this field we need to lead the thoughts and drive it into the right direction. I think that's a fair summary. So thanks a lot, James. So I think what I took away was, first of all, it's worth going the extra mile, like you did it with your medical degree, and I think that's very often in life the case. The extra mile brings you to greater goals. So that's something I took away. I took away that robotics is really something that is a topic that we need to watch and develop, and that we see in some parts of the world, like in China. We see it used very broadly already in clinical practice. And what I also took away is that You are very mindful, bringing your practices to success with caring about the team, providing a great platform for a team that then, can really be a high-performing team, because you have the mindset of creating a platform for them where they can excel. I found this an exceptional thought. So thanks a lot, James.
Yeah. I have to thank George and Andrew. And now we see Straumann is already committed in navigation. So I'm looking forward to see the later engagement in robotic. So
thanks a lot, James, also from my side. It was a very thoughtful, interesting conversation that we could have. So to all our listeners, thanks a lot for being part of this episode of Straumann ProTalk. Please subscribe if you like the content. Please also ask questions on our Instagram account. So we're really encouraging you for the interaction, and stay tuned for further episodes. Thanks a lot.